This is Ms. Wall, and we're going to be demonstrating the extraoral intraoral examination. And our patient is Mrs. Cushionen, who is a full-time instructor and clinical instructor. She's been nice enough to be our patient today. So we're going to demonstrate the technique. We're going to start with the extraoral, and then we're going to go inside the mouth. First, we're going to put on some gloves before we touch the patient. We're going to tell the patient what we're going to be doing. Ms. Cushionen, we're going to be doing an exam. We're going to be checking the outside of your head, your face, your lymph nodes, your glands, and then we're going to be going inside the mouth and checking for anything that may be abnormal. Okay? Do I have your permission to do so?
Yes, ma'am.
Okay. Let's put our gloves on. We want to have gloves on for the extraoral, and then we're going to change them for the intraoral.
Our first step is going to be to examine the skin of the head and neck for pigmentation, texture, and masses.
Okay, so let's come around the front, and let me just check out your skin and see if we have any areas that we need to be concerned about. Everything looks pretty good, so that looks normal. And next what we're going to do is what?
We're going to do bilateral palpation to assess the occipital nodes.
Okay, the patient would put her head forward for me, and I'm going to just slide up under your hair here. The occipital nodes are noted at the base of the skull. So you're going to palpate, and you're going to put a little bit of pressure because you want to feel if there is anything swollen. And if the patient has any tenderness, have them tell you that they have some tenderness so that you can note that when you document. Okay, next.
Next are the pre- and post-auricular nodes.
Post-auricular. The auricular is around the ear. So I'm going to demonstrate on this side so you can see. If I could have the patient take her glasses off for me during this, please. Thank you. We're going to just check those nodes around the ear on both sides. Bilateral means both sides. You can either do it at the same time or you can do it separately like I just did. Then we're going to do the pre-auricular, which is in front of the ear, because there are nodes there as well. And we're going to use pressure again, not a lot. You don't want the patient to feel pain or discomfort, but you want enough pressure that you can feel something if there's something there. Okay, what is next?
Now we'll come around to the front to check the submental and submandibular.
Okay, put your chin down for me, please. Just your chin. Good. I'm going to check her glands. And I tend to kind of roll it up over the mandible a little bit because that way if you got any bumps in there, you can feel them. Got a little something there. And then the submental, which would be up underneath the chin. Okay, what do we have next?
Cervical and supraclavicular nodes.
Okay, the cervical is along your sternocleidoid mastoid muscle, so you're going to have your patient turn away and put their head down slightly, and that will make that muscle come out nicely. And you can either palpate it on one side and then the other, or you can palpate it simultaneously like so. And you're going to go the full length of the muscle, all the way down to the clavicle. And then you're going to have her turn toward you, and you're going to do the other one. And hers are coming out nicely so we can feel them easily. Some patients, they hide a little bit and you have to kind of find them, but hers are nicely sticking out for us here, so it makes it nice and easy. Okay, those feel good, straight. And we're going to do the clavicle, which is the collarbone, and we want to ask our patient if we have permission. I'm going to be putting my hands along the front here, along your collarbone. Do I have that permission from you?
Yes, ma'am.
Okay. We ask that because this is a very intimate area on patients, and we want to make sure that we're not invading their space. That they know that we're going to be in this area, and that we're going to be checking along the collarbone. Okay.
Next, we'll palpate the parotid gland.
The parotid is up here in the cheeks, just distal a little bit. And we're going to just palpate, we're going to rub a little bit, and we're going to palpate, And again, we're feeling for any lumps or bumps. Any tenderness from the patient so far?
No, ma'am.
Okay, good. Okay, next.
And now the thyroid gland.
The thyroid, of course, is located in the neck area, and we want to find the thyroid. And it's not going to be way up here, and it's not going to be where you might think it is. It's going to be further down, and you should be able to palpate and feel it right here. Okay? We're going to just palpate it to make sure that it feels normal in size, that we're not feeling an abnormal large one, or maybe an abnormally small one, or one that may have a bump on it. Okay, swallow for me. Okay, that makes the thyroid gland move so that you know you're in the right place. Okay, good.
And now we'll check the TMJ.
Okay, you come around the front for that. The TMJ, of course, is the temporomandibular joint, which is up here. Go ahead and open for me and close. One more time and close. Open and move from side to side. Okay, and straight forward. Good. I didn't hear any noises. I didn't feel anything. So that feels good. Okay.
Now we can prepare for the intraoral exam.
Okay,
So
in order to do that, I'm going to deglove. I probably should have opened my kit first, but I'll do that when I get my gloves on. I'm going to put the patient bib on. And we're going to use our little sticky tape here, our little bib holder. These are nice because you can just throw them away when you're done. You don't have to worry about those clips that we used to use all the time, which are hard to disinfect and to sterilize. So we use our little disposable things here, and it helps us a lot. And if the patient could take off her lipstick for me, please. As much as you can anyway. The patient indicated it was a stain, so some of your patients may have a lipstick that has a stain in it, which may or may not interfere with your looking at their lips, but you do the best that you can with that.
And now the pre-procedural rinse.
Okay. I'm going to have you rinse for 30 seconds, and you can use this suction here, and I'll let you know when to spit it out. There's a little lever here. Flip it up, you can suction it out. Okay? I'll take that from you. Put that away. And I'm going to put my barriers now. I'm going to put my barriers on my keyboard and my mouse. Okay, spit it out now. I can find where this opens. There we go. We're going to just cover our keyboard because we're going to put gloves on now and we don't want to contaminate the keyboard. And we're also going to put a barrier on our mouse because we're going to be using our mouse when we're documenting in our software. Okay, so those are ready to go. We won't actually be documenting this today using our software, but this is when you would, you probably would have had your A2 software open already and started documenting what you found. And when you get your gloves on, you want to make sure that you have barriers on everything. So I'm going to put another pair of gloves on now, and I'm going to open my instruments. Am I getting ahead of you?
No, you're good.
Okay. Let me know if I skip anything. What? Oh, thank you. Sanitize first, because I've been touching some things. Okay, sanitize, sanitize. If ever in doubt, sanitize. So we don't have to wash our hands between everything. We use sanitizer. But we do wash our hands thoroughly before our patients, at the beginning of our clinic and at the end of our clinic. We want to wash thoroughly before we leave the clinic floor. And I've got to let this air dry a little bit. Hang on there with me. Otherwise my gloves are not going to go on. Okay, now we'll put the gloves on.
And then we will open the cassette
Okay.
and tape down the cotton roll.
Okay, and I've already secured the tray, and we talked about that already previously when I was setting up the unit. I've secured the blue wrap, and it's covering the bracket table. Now I can open up my tray because I have clean gloves on. We simply unlock it and open it, and we take our little indicator strip and we place it over here on the mobile cart top where the instructor can see that it's there. We're going to secure our little cotton roll here in case we need it. And we're going to open our tray. All we're going to need for this procedure is the mirror, so I'm not going to open the other side at this time. Okay?
So first we will check the lips and vermilion border.
Okay. I'm going to sit down now and I'm going to recline the patient. Put your eyewear on for me again, please. Pull the bracket table over toward me so I don't have to stretch and reach for it every time I need to make an adjustment. And we're going to set the patient's chair back. We want to do that so that we're able to see. If you don't have a lamp, on your forehead with your glasses, then you're going to need to use your light. I like to use the light anyway because it adds some additional light. All right. Yeah, she's got some stain on her lips, so that might be something you note, that she just has stain on her lips and that you weren't able to thoroughly evaluate the vermilion border in the lips. But you do the best you can. So you're looking at the lips on the outside now. You're going to look at the corners very closely to make sure there's no cracking or no scabbing or anything like that. Okay?
Next we will retract the lips, check the upper and lower labial mucosa.
Okay, the labial mucosa is inside the lip area. So we're going to retract the lip and we're going to really pull it out so that we can look at it very thoroughly. And then we're going to check the maxillary area. And we're looking at the frental areas, the frenum. Many times you'll see little polyps or little papules on those. So you want to really look at those closely. Okay?
And the mucobuccal fold.
Okay, we did that. Let's go.
Retract your cheeks.
Okay.
Look at the buccal mucosa.
Get my mirror now. I'm going to pull your cheek out here, and we're going to look at the buccal mucosa, which is the cheek tissue. Buccal meaning cheek area.
And the vestibules.
Okay. Looking at the vestibules. She's got a little linea alba. Otherwise, looks pretty good.
Next we'll check the alveolar process.
Okay. The alveolar process is what the teeth sit in. The bony area. So we're going to take our fingers and we're going to just feel on both sides as we come around. She's got some tori. And we're just feeling to make sure that it's nice and firm. And then again, we're not feeling anything abnormal. A little exostosis. And you'll learn some of these terms as you go through your education. So if you don't know the terms right now, that's okay. Okay?
And the hard and soft palate.
Okay, we're going to palpate the hard palate. And you want to put a little pressure, not a lot, but enough that if there's a cleft, which is like an opening in the palate, or if there's a torus, that you're going to be able to feel it. You want to feel the entire palate. And then, hopefully you don't have a gagger, because they will gag at that point. And then we're going to look at the soft palate. We're going to pull out our mirror. And we're going to look at the soft palate. Okay, looks good, looks good. No redness.
Okay. Now we want to retract the tongue, examine the tonsillar area, regions.
Say ah for me. Excellent. Perfect.
And identify her
I think she's a 1.
She's a 1.
Mm-hmm. You can see pretty good back
Yeah,
there.
you don't even need a mirror.
No. I mean, it's like wide open.
And now with the gauze, we will examine her tongue.
Let me wet this a little bit. I don't think we have water, though. I think we ran out of water. So. Usually I take my gauze and I kind of open it up and wrap it in half. Because what you're going to do is you're going to grab the end of the tongue, stick your tongue out for me, like so, and you're going to hold it. Because what you're going to be doing is you're going to be pulling it to one side and to the other, and you're going to be examining the tongue very, very, very closely. This is a real high area of oral cancer occurrence. So you really want to look at it closely. And you're going to pull to the other side, and you're going to examine the other side as well. I usually feel it as well, just to make sure that I don't feel anything abnormal. Okay.
And then palpate the floor of the mouth.
And I also use the mirror to look at the sides of the tongue.
Oh, okay. That's good to know. Thank you. Stick your tongue out. I'm going to palpate the tongue a little bit here. Didn't get the tip with that on there. Okay, now we're going to look at the floor of the mouth, which is underneath the tongue. So have the patient raise their tongue to the roof of their mouth. Get your mirror out and closely examine for any abnormalities, again, any bumps, lumps, anything that you think is out of the norm. You're also going to look at the frental area again. Sometimes people have what we call ankylosing, which is just where there's a short frenum, where it's hard for the patient to put their tongue to the roof of the mouth without closing their mouth. So that's that's very common. You will see it in many patients. It's not really anything to worry about because patients have lived with it, but it is something that you would need to note. Okay, what do we have next?
Now the bimanual palpation to examine the floor of the mouth.
Okay, we're going to take our index finger on the inside, and we're going to take our middle finger on the outside because we've contaminated the thumb and index finger, and we're going to push against our index finger. We're feeling again for anything that is out of the ordinary, and we want to go back here a little bit. We want to make sure and get the entire floor of the mouth as thoroughly as we can. Okay, that feels good.
Okay. Now we're going to check occlusion.
Okay, now we're going to have the patient, okay, open for me. I'm going to put my fingers in. I'm going to have her bite her teeth together the way she normally does. What we do now is we're going to check the occlusion, which is going to be a classification of how she bites her teeth together. If you haven't learned that yet, you will. Okay, what's next?
And then any deviations from normal within her occlusion and
Okay.
dentition.
Looks good. I don't see any cross bites.
Checking for attrition, abrasion,
Open.
erosion.
We have a little attrition on the anteriors. Yeah, a little
Hyperplasia,
attrition.
stain.
Okay, go ahead.
And now we'll check the periodontal tissues,
Okay.
color, contour, consistency, and texture.
Okay, close a little bit for me. Good. So just pull the lip out, and we're going to look, and we're going to see, and we're going to describe what we see. You know, what is the color? What's the consistency? How does it, how does it appear to you? Is it red? Is it bleeding? Is it nice and salmon pink? Where's the papilla? Do we have any embrasures, which is like open areas between your teeth? Or does the papilla come nicely into those contact areas? Okay, go ahead.
And after that, we will just make sure we've documented all of our findings,
Okay,
any pathology that we see.
okay. And you can close. And that's going to be that. So thanks, and I hope this helps.